1450 WOL, where information is power.
Welcome back. You are listening to the C. Allen Morning Show on WOL 1450 AM. This is Beauty Talk Radio, and we're talking to Dr. Letitia Plummer. And you were just telling us about how a winning smile exudes confidence.
Yes. So I attended this school, and I realized that all of the young ladies and gentlemen in the room just did not have a smile that exuded confidence.
Wow.
And the more important piece to that, though, is they didn't have the money either.
Mm-hmm.
Okay, that's an important piece.
Because cosmetics is incredibly important. So after I did my talk with them and explained to them how in 7 seconds they're judged, and so when they have their hand over their, and this can be in dating or employment or anything really, when you kind of tuck your head and you have your hand over your mouth, or you kind of partially smile, all of those things show a sign of insecurity.
That's right.
Mm-hmm.
And when you're interviewing with someone, they don't know if that insecurity is just you personally, or maybe feeling that you're not really capable of that job. When you're dating someone, it may, you know what I'm saying?
That's a great point.
You don't really, the other person doesn't really know exactly why you're feeling that way.
Mm-hmm.
So it makes the other person, judge you.
That's right.
And so what I found is that, once I talked to these young people, and they all understood the concept and they understood what I was saying, but they all came up to me after the talk and they were like, Dr. Plummer, how much does it cost? And so I heard that over and over and over again. And so what I decided to do was put together a sponsoring situation to where a church or a family member or the employer that wanted to hire this particular person, if they wanted to make an investment in them, and all I did was just charge just my basic, just to cover costs.
Mm-hmm.
Right.
I was not making any money on my end. It was just covering the cost of the treatment.
To get the job done.
To get the job done. So we've done about 75 cases. A lot of these young adults now call me all the time, and they thank me, because one young lady interviewed for the job with the gold crown, went back and interviewed for the same job about 2 months later and got the job.
Wow.
Results.
But they're not going to tell you that. You know what I mean?
Exactly.
But, yeah.
The employer,
they can't really.
No, of course not. Of course they can't. But what we have to understand is that, we're representing the person that we're working for,
Yes.
in addition to representing ourselves.
Well, I have a
I think that's awesome.
Yes, it is. A skincare related question.
Okay.
I have my 60 plus. Some of the women that I work with are considering cosmetic procedures.
Okay.
And I heard somewhere that they should go to a cosmetic dentist first because apparently, is it true that some of the traditional cosmetic procedures enhance the result because of placement of teeth and lips that you would get with a facelift or whatever else you're doing?
Oh, most definitely. When a person is of age about 55, 60, 65, the most common thing that I find is that they've ground their teeth down.
Mm-hmm.
And if you can kind of imagine this, if you grind your teeth down millimeters, just from normal wear and tear, your face kind of collapses.
Wow.
If you put your finger on your forehead and then the bottom of your chin, and you take that measurement.
So it's the placement of the teeth in the jaw?
Yes, because I can actually open your bite and will literally fill in your face. And you won't, how your all of us have our grandmoms that have, dentures.
Right.
Mm-hmm.
When they take their denture out their mouth,
Oh, yes.
do you remember how their lip kind of pokes out and their lower chin pokes out?
Mm-hmm.
And then when they put their denture in, their whole face kind of fills in?
Right.
All we've done is increased, the teeth have done all of it.
Wow.
Is that
Kind of a
what's
natural
called
facelift.
a dental lift? Is that what that is?
Well, no. We're just restoring the teeth back to their natural
the teeth
place.
to their placement. Okay.
Wow.
Right.
Okay, that sounds
That's
awesome.
magnificent.
This is. I'm going back to Dr. Plummer. The show is geared towards beauty, and we have so many hairstylists and barbers and students listening. My final question is, in your opinion, what do you think would be the best quick smell good before you go into the public, before you greet the public? Because, of course, if you can't, let's say you're somewhere and you can't brush your teeth and all of that.
Right.
So you're saying like gum versus this versus that?
Or Altoids or what have you.
Or that little mini toothbrush that they have now?
Yeah, so Dr. Plummer, not Seven Brown.
I'm
Tell
just
me.
getting clarification.
I understand. Dr. Plummer, we love each other in here. I want you to I want you to do
Can't
that.
you tell?
All right, so talk to me.
One thing I found that really works the best, you know those Listerine strips that you place on your tongue?
Yes.
Oh, yeah.
Those work really well, especially in your situation to where they're in front of the client. You don't want them chewing gum or sucking on candy.
Mm-hmm.
You know, those Listerine strips work really, really well, I think. I stay away from the Altoids and the things that have a lot of cinnamon in them, because a lot of people don't realize that they may have a cinnamon allergy, or their gums don't really respond well to that.
Okay.
So if I would have picked anything that's on the market right now, I'd probably choose that.
Okay. Now, another one. I said that was the last one.
I know. I have some too now.
Okay, but listen, talk to me about the importance of using mouthwash. Since you mentioned Listerine, I mean, should we really use mouthwash, and how often?
That was my question.
Okay, that's a beautiful question. I'm so glad you brought that up. So when you choose a mouthwash, you want to make sure you use one that does not have alcohol.
Okay.
Listerine now has come out in the market with an alcohol-free mouth rinse.
And why shouldn't we use alcohol?
What alcohol does is it kills the natural good bacteria in your mouth. Okay? And it allows an overgrowth of the poor bacteria, the bacteria that causes the halitosis.
So it makes it worse.
Exactly. So if you just kind of remember using mouthwash, about 30 minutes later, do you notice that your mouth tastes the same as it did before?
And you know what, Dr. Plummer?
Worse.
And you know what? That's so ironic that you said that, because I have a gum disease, and I would use mouthwash, and I swear to you, about 30 minutes, my breath smelled worse than it did prior to me using it.
Exactly, and that's exactly why. But at the end of the day, I just recommend everyone going in for their 6-month cleaning. Go to your dentist.
Okay.
And I wanted to say one really quick thing that's so important. Diabetes is high in our community.
That's right.
High blood pressure is high in our community. We're talking 40% high blood pressure, 14.7% diabetes. Those things all contribute to periodontal disease.
Wow.
That is interesting.
Okay, and so what I really would like for all of us to understand is this is a bigger picture than just our mouths. You're swallowing all of that bacteria, and now what they're finding is it's contributing to heart disease as well.
I heard that.
Yeah, so it's truly feeling good from the inside out. And I think both of you guys talk about that a lot.
Yes.
We do.
It's not just what you see on the outside. It's kind of having that come from the inside. And when you're healthy on the inside, you're naturally going to look beautiful and feel beautiful.
We have a question from the studio. See, this is opening a can of worms.
Go ahead, Alonzo. What was your question?
He said, this is our engineer, Alonzo. See, everyone's listening. He wants to know if it matters what you eat.
Oh, definitely. Definitely. So if you eat foods that have a high acidic rate or value, you keep the pH in your mouth higher, which makes you more prone to periodontal disease, and in addition to cavities. So yes, you want to stay away from incredibly acidic foods. And, spicy foods are okay, but, spicy foods typically stay in your mouth a bit longer.
Right.
So, yeah, Gatorade, high sugar things. Believe it or not, guys, Gatorade has such a high amount of sugar in it.
That makes sense.
Yeah,
Wow.
Gatorade, and even the things our kids drink with juices, and even our waters.
Okay, this is really, I promise, the last question.
Okay.
What age should you take your child to their first dental appointment?
I really like age 3.
Okay.
Wow.
Age 2 is nice as well, though, and what I like my moms to do, or even dads now, is to bring their patients in to their 6-month visit.
Okay.
And they can kind of see the space and kind of, get comfortable with the sounds of our hand pieces and things like that, and kind of get them acclimated to that space. But if you've got a kiddo that's really anxious, pediodontists, which are dentists that are specific for children, are a great place for them.
Okay.
Okay.
Make them comfortable.
All right.
You have been a wealth of
Yes,
information.
indeed. All right, Dr. Plummer, our time is up. When I tell you, Dr. Plummer, you have answered. I was just writing down and all of that.
But we need to know where to get in touch with her.
Exactly. For all of our listeners who have more questions about this 6-month cleaning or children going into age 3 and all of those things, how could we get in touch with you?
Well, my website is Maxwello Dental Spa.
Can you spell that for us?
Sure. MAXWELLO Dental DENTAL Spa SPA.com.
Thank
Okay.
you so much.
And all of our information is on there. Can I say one more quick thing?
Sure.
2 seconds. Periodontal disease also influences low birth rate babies. Okay?
Wow.
Okay.
African American women have the highest mortality rate for infants.
All right, we
Thank
gotta
you
go.
so much.
We
Okay?
gotta go. Thank you
so much.
All right, everybody. We'll be right back after these messages. It's all about oral health and oral beauty live on the C. Allen Morning Show.
1450 WOL.